There is a condition in which the blood glucose is neither normal nor diabetic. Hi everyone, this is AY the Diabetes Doctor. I'm a doctor and a specialist on diabetes. Today we are going to discuss a condition in which an individual blood glucose is high, but not at the level that defines diabetes. This is called prediabetes, or others call it borderline diabetes. This condition, individuals will check their blood glucose, whether it's fasting or random, and notice that the blood glucose is high, but you cannot really say it is diabetes. So if an individual does a fasting blood glucose in which you stay up to 8 hours without eating and not more than 12 hours without eating, and you check your blood glucose and it's between 6.1 to 6.9 according to World Health Organization, you are regarded to be pre-diabetic. So how about random? So if you do a test called oral glucose tolerance test, this is a test that assesses your ability to utilize glucose. So if you do this test, which requires you to stay without food for 8 hours. After that, glucose, 75 grams of glucose is given. Then 2 hours later, the blood glucose is checked. If your blood glucose is between 7.8 to 11.0 millimoles per liter, you are regarded to be pre-diabetic. So, but the issue here is why the concern about pre-diabetes since it is not diabetes? The issue here is if you are pre-diabetic, you have high risk of transitioning to become diabetic. And also, at the state or the level of pre-diabetes, already some complications have begun, such as problems with the eye, problems with the kidney, and problems with the nerves. All these complications have already started. So that's why we are worried about prediabetes. So the issue here is, since prediabetes, though you are not presenting with symptoms, give this complication, what is the way out? It is important for you to reverse from prediabetes to normal. We don't want a situation where a pre-diabetic patient becomes diabetic. So there are several steps that need to be taken to ensure that. One is diet. So when we look at diet, we advise that you stop all simple and refined sugars, such as sugar or all beverages that have sugar. Then it is advised that when you're eating, only 25% of your food should be carbohydrate, while the other 25% should be protein. Half of your food should be vegetable. That's the healthy diet. So for fruits that have high sugar content should be avoided or should be taken in small quantity. And then exercise is extremely important. In our previous videos, we discussed that exercise helps reduce the blood glucose, exercise helps reduce blood pressure, stabilize your cholesterol level, and reduce anxiety and improve sleep. So exercise is also important for people that are pre-diabetic that want to be normal. So you need to exercise at least 30 minutes a day, 5 times a week. It can be brisk walk, it can be running, it can be cycling, or any other aerobic exercise. But if possible, you can combine it with resistant exercise. Then another option is medication. In some instances, your diabetes specialist may give you certain medications such as metformin, popularly known as glucophage. Then those that smoke need to stop. Those that drink alcohol need to stop drinking alcohol. So the issue is that the world is focusing on prevention rather than cure. So we don't want people that are pre-diabetic to become diabetic, people that are normal to become pre-diabetic. So if you have risks of developing diabetes, such as you have obesity, you have hypertension, problem with cholesterol, lack of exercise, poor dietary habit, you are at risk of becoming pre-diabetic. And if you're pre-diabetic and you continue with poor lifestyle in terms of your eating, your exercise, you can easily become diabetic. But a word of caution, if you take steps as a pre-diabetic individual and become normal, it is important that you maintain that normal by continuing that dietary changes and exercise. Because if you go back to how you used to eat, there's high likelihood that you may become pre-diabetic again and even diabetic. So I believe we have understanding of what pre-diabetes is. If you like this video, kindly subscribe so that anytime I do a new video, you'll be the first to watch.